Hello, everyone. Thank you for coming. It's really a pleasure for me to be here, particularly because I've known Nancy Stevens and Rick Rosenthal for many years, and I can tell you that in the city of Los Angeles and across the United States, they really are two of the most compassionate people I have met, and their work is so important, both in policy and in the arts, and in just as models of being decent human beings. Tonight, we're going to really kind of dig in and talk about end of life and how it's reflected today and in the past in media. And more importantly, what it means for the future. And talking about end of life issues and how media can reflect on those questions that are, plaguing us now in terms of costs and just the troubling problems that we all face in dealing often with these issues, and maybe sometimes they need not be troubling. So we're very fortunate to have a panel that has thought very deeply and compassionately about these issues. So I'm going to invite them up to take a seat, and I'll introduce them. First, starting on my right, is Jay Clayton, who teaches courses in contemporary American literature, genetics and literature, film and media, Victorian fiction, hypermedia, and online gaming and literary theory at Vanderbilt. I wish I could have taken your courses. His current research involves the ethical and social issues raised by medicine and biology as they appear in literature and films. I really do have a lot to learn from you. He currently serves as director of the Kerb Center for Art, Enterprise, and Public Policy at Vanderbilt University, and he was the past president of the Narrative Society. Next to Dr. Clayton is Dr. Kathleen Foley. She is the attending neurologist in the Pain and Palliative Care Service at Memorial Sloan Kettering Cancer Center in New York City, and is also professor of neurology, neuroscience, and clinical pharmacology at Cornell Medical School. She's the past director of the Project on Death in America of the Open Society Institute, whose goal was to transform the culture of dying in the United States through initiatives in research, scholarship, and clinical care. Dr. Foley is currently the medical director of the International Palliative Care Initiative of the Public Health Program of the Open Society Foundation, and she's working to advance palliative care globally. Dr. Foley is a member of the Institute of Medicine. Among her many IOM activities include serving on the National Cancer Policy Board and co-editing the IOM report entitled Improving Palliative Care for Cancer. And finally, next to Dr. Foley is Brian Dorries, and he is the founder of the Theater of War, a project that presents readings of ancient Greek plays to service members, veterans, caregivers, and their families as a catalyst for town hall discussions about the challenges faced by military communities today. He's also the co-founder of Outside the Wire, a social impact company that uses theater and other media to address pressing public health issues such as combat-related psychological injury, end-of-life care, prison reform, political violence and torture, and the destigmatization of the treatment of substance abuse and addiction. So as you can see, we have a wonderful panel. So we're going to begin by giving you a flavor of past stories in a little montage of end-of-life matters. So could you please run the montage?